Welcome to Adapt NCLEX, and thank you for deciding to watch this video. Interdisciplinary team. This is a problem people, nurses are having issues with. They've seen this in their exams and having difficulty answering questions. So subscribe or request. I'm going to do a little bit of justice to it. Stick around and see what I'm going to do. Sometimes the NCLEX will throw things like this to you. You never seen it before, heard about it before. But just relax, just break the whole question and analyze it, and you see that, oh, it's a big word, but it's something you've done multiple times. Let's assume that you have a patient that has asthma. Okay, has asthma and has had like a recurrent infection. So every time mommy has to take the patient to the emergency room, will require admission multiple times. Therefore, this client is going to miss school, to go out of school for a long time, multiple times. If this happens multiple times, it's going to be a problem. But guess what? We can help with this problem so that we don't have recurrent infection and then mommy missing work and kids not having the chance to study in school. So let's assume that this is the asthma patient, okay? And they have what? Recurrent infection. And we know recurrent infection, which organ does it affect? It's mostly the lung. It's the lung that is involved. And therefore, we need people to be able to help this patient take care of this lung that is affected, their airway that is usually having multiple inflammation and bringing them to the hospital. So what happens? They will need a pediatric doctor, a physician. So that's their provider, right? Because of the recurrent infection, they need a respiratory therapist to help them manage their airway in the hospital, even sometimes at home, to help them breathing technique, right? Then what happens? Sometimes this asthma, they may be allergy related. Some diet they eat, the food allergy that will worsen their problem, recurrent. They go and eat something and all of a sudden they're in respiratory distress. So they will need a dietitian, right? All these people, what are they doing? They're working together. And finally, the kid will need an asthma counselor. Okay, so there will be a counselor who will help with the kid in order to manage their medication, how to take care of them counseling them about the triggers, what to avoid at home, how to manage their home. And guess what? There may be somebody, they may have to see all these people. Seeing these people who require multiple hospital visits, loss of what? Manpower by the mother, loss of school activity, and therefore we need somebody to be able to coordinate. We need a social work, okay? Coordinate all these functions so that the kid probably can come to the hospital once and see all these people at once, instead of going to see a counselor Tuesday, a dietitian Monday, a respiratory therapist, and a provider to make sure everything is going on. So all these people coming together to help with what is going on. All right, so that's one case. Let's look at another person. We have a 50-year-old guy, male, with a history of hypertension. He came in with a blood pressure of 250 over 110. And a CT scan shows it intraperitoneal hemorrhage, basically hemorrhage. And this patient was diagnosed with stroke. As you know, and then he has a left-sided deficit. We have a problem. A stroke patient, hypertensive patient now develop a stroke and now left-sided weakness. What do you think is going to happen to this patient in the hospital? So we have a stroke patient in the hospital. Number one, this patient, his airway needs to be protected. most likely he will be intubated. If he need intubation, if his airway need to be intubated, if the airway need to be protected because um, initially he was having a airway issue, he may have to be intubated. If he's not intubated, he still needed somebody to help protect the airway, right? You also will need somebody to help with the swallowing, okay? To teach the client another way to swallow, because sometimes cranial nerve 9 and 10 are affected. So his gag reflex will not function anymore. So he will not be able to swallow right away, right? He has weakness on his left side, so therefore he has to be able to move, and he has to be able to do activity of daily living. So he may need a respiratory therapist to help with the airway protection. He may need speech, okay, to help with swallowing, speech therapy, because he may have dysphagia. Okay, he may need occupational therapy. These people help with activity of daily living, dressing, take anything that involve above your hands, above your breast. So anything that is above your wrist, they are in charge, and they help with managing. We will talk about them in detail, but I'm just giving you what is going on. They will need a physical therapy, right? Who will help with mobility, balancing, and gait. Of course, they're going to have their nurse, okay, who will advocate for them. If this patient is trach, yes. If he has a tracheostomy, yes. The respiratory therapist will take care of it. If he has a gastrostomy tube, because he has a G tube, speech therapy will help with that. Of course, there will be a dietitian who will help with the choice of food, okay? That will bring properly diets that they need. All these people, and of course, don't forget his doctor, his provider. You see, you getting the picture now? And who is at the center of all this? Patient. You cannot have interdisciplinary team without the patient being there. So that's another patient I want you to think about. So let's go to the third patient. Third patient, you know it, 35-year-old guy has some UR symptoms. 3 weeks later, he has weakness of the bilateral lower extremities, lower leg, weak, numb. All of a sudden, his knee, upper extremities, then airway issue. What do you think? This is what we call GPS, right? Guillain-Barré syndrome. You should be able to recognize this. This is an NCLEX next generation type of question. Okay, Guillain-Barré syndrome. So you started initially with lower extremity weakness. All of a sudden, you're having ascending paralysis. We have ascending paralysis, and we have a problem, right? This patient, if you look at them, if I draw them like that, this is going to be weak, the leg. You'll be spastic. You'll not be able to move it. The upper extremities will do the same thing. The bladder is not going to function. Okay, respiratory problem, speech problem, feeding problem. So they have a G tube, they have a tracheostomy. Sometimes they will have chronic indwelling Foley catheter, or sometimes they put a catheter, suprapubic catheter. So they will put suprapubic, just through the bladder, and it will be coming out from the pubic area. As you can see in the word, physical therapies to help with mobility, which you cannot move. Occupational therapy to help prevent contraction and movement. And speech therapist, okay, who will help with the swallowing. okay? And then feeding, dietitian to choose proper feeding, social worker to arrange things, right? Discharge planner, you know what to do. Case manager, all these people, of course. The nurse is also in charge of the patient. So as you can see, there's a bunch of healthcare professionals, different specialty working together to help take care of this patient. And that is the definition of multidisciplinary team. So basically, it's a healthcare professionals, say, or health professionals from different specialty working together, take care of one patient. Basically, making sure the whole patient is taken care of in terms of specific need. Sometimes the family and the patient may also be included in the team. So it's part of it. So this is what this interdisciplinary team is, as you can see. So I give you a case so that you can analyze and see and make sure that you understand without giving you just the definition. You have to know the function of each of them, and then that will make things a little bit better if you know, because that's what the question will ask you. Sometimes they will ask you, what does this patient play? This provider role does they play? Yeah, there's a bunch of people that form portion of this system. So let me clean this, and then we'll talk about each individual provider. So who is the first patient? Number one is the patient. So you form the center of all the team. Without a patient, there is no interdisciplinary team. To the provider. The provider is loaded. So you can have somebody with the MD, somebody with the DO, some nurse practitioners, okay? Nurse practitioners can form portion of these MD providers. You can have PAs, you can have residents that work with the doctor. So they are part of the providers, and basically they ensure and that the proper care is provided. So they know medical staff, all the things that the patient, the medical issues for that patient, they are in charge of it. So the medical issue. Of course, you have your nurse. That is the what? Advocate. You know every detail about the patient. And then make referrals. If the patient needs anything, she provide, talk to the family, acts as an intermediate for the patient need. So that's number three. Number four, there's no in any order, whatever you want to choose. The physical therapies, people get confused. Physical therapy and occupational therapies. So the physical therapies dealt with anything that is below your breast. But the other things you have to pay attention to your breast. So anything below your breast, they are in charge of it. But the key thing is mobility. So they involve in mobility, transfer, moving from one place to another, and they involve with your balance, your gait. If you have gait issue, balance, patient at risk of fall. Yeah, anything related to that, the falling and everything, they help ensure your balance, your transfer, your mobility, even proper use of walker, or what we call the supportive devices. Yeah, they are in charge of this. So don't confuse physical therapy with occupational and therapy. Proper use of walker and training, yeah, physical therapy does that. The occupational therapy, OT, anything above your wrist. So they're in charge. So like your hand, okay. So they deal with things related to ADL, activity of daily living. So when patient need to learn how to dress, yeah. So dressing, occupational therapy is in charge of it. They help with the dressing, bathing, they're in charge of that. They will help with all this information. Then even your cognitive function, thinking and perception, occupational therapist does that. Like I say, anything above your wrist. So if you have a hand motion, contractures, yeah, contractures of the hand, yeah, they will help with that. They will help you coordinate those functions. And so don't confuse the difference between physical therapy and occupational therapy. Occupational therapy, anything above your wrist and your hand movement, anything that you have to use your hand, activity of the daily living, dressing, bathing, is different from a physical therapist. Okay. Who else? You can have a pharmacist. So they're in charge of medications, and they look for medication interaction. If the patient is taking a bunch of medication, yeah, to make sure there's no allergy, anything like that, they will take care of all those things. Very, very important. Okay. And then speech therapist. These are the people, if patient has dysphagia, that's the most important key. Dysphagia, like the stroke patient or the GBS patient, they can't swallow and everything. Speech therapy will help to swallow steady, and they will figure out what kind of food would be best to prevent aspiration. So they help with swallowing and your speech communication. They will talk to you about it, improve your speech. If you have stroke, they will help you gain back your normal speech function. Okay. And then the dietitian can use whatever the speech therapy have found to provide proper food. Okay. Proper food for the patient. The speech evaluates which food would be good, and the dietitian will give it to them. Or the dietitian will recommend certain food because of your medical problem, like diabetes. Some patients with diabetes, they see a dietitian provide teaching. These are the food you're supposed to eat to improve your cholesterol or to ensure your sugar is not overwhelmed. You see a bunch of people involved. And then let's look at a case manager and social worker. So the social worker, basically, they are in charge in ensuring you finding resources. They are in charge. They help with resource, both before, after discharge, in order for you to be able to function properly. Resources, they can lead you to appropriate places. And they also involve in discharge planning. The case manager, though, they perform important function. I like them because they, as soon as you come to the hospital, right away they start making recommendation, finding places where you will go after the hospital stay, whether you need a rehab or anything like that. They start looking for it as soon as you step on the as soon as you step in the hospital. They start working on you, planning for your discharge, looking for other things that you need at home, and they will provide everything. They also will provide some financial resources in order to help with the home problem. So they play a big role, very, very big role. Okay, so you can see a bunch of patient people working together to ensure the safety of the patient, and then looking for one thing to ensure patient is medical problem is taken care of appropriately. That is a interdisciplinary team. Interdisciplinary team. And so if you see a question, you say, hey, who need interdisciplinary team? There's one more. There's the last one patient I want to focus for. People always forget about this. Patient who has conflict with nurses. Yes, if there's a patient admitted and has conflict, sometimes we forget about it. This patient can be manipulative. And so they can manipulate nurses and it can cause conflict among nurses. Different nurses will have issue with the patient, and therefore patient needs are not being met because of the way the patient is behaving, manipulative. Because of that, interdisciplinary team will meet, and this is this patient. Everybody will come in and provide their input, and they will tell us, this is the way to deal with the patient, all the things they've seen that is working. Some people, some patient will be splitting, okay, because they are manipulative. So all these people will come, all the nurses, charge nurse, case management, everybody, whoever have had interaction with the patient will come, and then they will come up with the plan. This is how we should deal with this patient so that we don't get into trouble about the conflict and not meeting the patient need. So this is another patient. It's not only a patient who is really sick or has a complex medical problem that need complex needs and interdisciplinary team. It can be a patient who has a conflict with nurses. So if you see a question, who need interdisciplinary team, think about it. Somebody with medical problem that need complex care. They need complex care follow-up that have to be coordinated. You need multiple professionals to work hand in hand to help solve one particular issue with the patient. So apart from this, then you look for a conflict. So if they give you answer choices, look at somebody who you think you will need multiple services. An example, so let's do some exercise. So assuming they give you this question, select or apply. So Saka, which of them is true? Which of this is very true? So a case manager, and I'll put in charge of post hospital care. Number 2, respiratory therapy. Right? Charge of patient airway, breathing treatment. Number 3, physical therapies. Okay, help with dressing, teach the client how to dress themselves or do ADL. Number 4, occupational therapy. 5, therapist teach client proper gait and balance ideas. Okay, and then 5, speech therapist helps with management of dysphagia. Which of this is true? Of course, for now, you pick those that you're confident and that you know. So which one is true? Case manager, yes, they involve in post and discharge care, basically after the hospital. Respiratory therapist also involved in the airway. Physical therapist does not do this. Anything above the wrist, physical therapists don't do that. Above the wrist, they don't do that. They only do things below the wrist. Dressing ADL is done by occupational therapists, OT. Okay. Occupational therapist does not do proper gait or balance idea. This is done by the physical therapist. They always trap you with this. Watch what occupational therapist does and what physical therapy does. They very different. Occupational therapy does things above the wrist. This is proper gait and balance is below the wrist. So they don't do that. Speech therapy, yeah, help with dysphagia. So this is how the question would be, which one you assign to each particular place. The other thing too, I want you to pay attention to who need interdisciplinary care. One more patient, I will use it as an example, is the kid with the cystic fibrosis. Cystic fibrosis. So this is just a prototypical, you can think about it. These people have what? Secrete and sodium and chloride channel problem, right? And therefore their secretions are really, really thick. And therefore their lung has what? Recurrent infection. And their pancreas has exocrine and endocrine problem, mostly exocrine and endocrine issue. Therefore, they need a couple of people to assist with management. They are long, they need a doctor, right? So MD, a provider, anybody can be a provider. Then they need chest physiotherapy, okay? Who does the chest physiotherapy? It's the respiratory therapist. The respiratory therapist will help with them, okay? They also has to be a counselor who will help them avoid triggers for recurrent infection. In terms of their pancreas, okay, they need a dietitian to teach them which food they should avoid, which food they should eat, and then when to take their vitamins. They will need vitamins A, D, E, K. They need to have food that has this vitamin in it, or take their vitamins. At the same time, when to take their enzymes with their food. All this teaching will be provided, right? It's very important that they know all these things. These people are going to provide all the help that is needed. Of course, they need a social worker and a case manager to coordinate their care because they will have multiple appointments back and forth, back and forth. They may have sugar regulatory issues, so they will need endocrinologist. All this thing is part of the interdisciplinary system. So one problem is not two problems. That's the key. One problem. We're dealing with cystic fibrosis. That's all. But out of that, we need multiple providers to fix it. That is interdisciplinary. It's not like multiple problems for the diagnosis. We are not dealing with multiple diagnoses. We're dealing with what? One diagnosis. So cystic fibrosis, then you have multiple providers coming together to provide care for one particular problem. So when they give you a question, look at it and see if it's a one problem with multiple people involved to solve that problem. If it's a multiple problem, yeah, it's not, but one problem, underlying diagnosis to do that. So this is the end of it. I hope you understand what an interdisciplinary team is, what they made up of it, and what each component part they play to help with the sustainment of the patient. Thank you very much. Take care and all the best of luck.